Hi, ladies. Today we are giving you 5 holistic tips for over-tight pelvic floors. Hi, I'm Jenn Lormand, exercise physiologist.
I'm Christina Walsh, licensed physical therapist, and this is an issue that more and more women who come and hang out with us here are dealing with for a fact. It's over-tight or hypertonic pelvic floor means the same thing, which we should mention here also means weak pelvic floor. Over-tight does not mean strong.
Yes.
And the first question that often comes up is, I don't know, is this me? How do I know if this is me even to begin with? Because it is really complex because a lot of the symptoms, the issues that come up when you have this going on
Yes.
are similar to if you just have a weak pelvic floor. So how would you know if you've got this?
So first off, I want to say right off the bat that we are not making any diagnosis. This is just some common factors that we have seen from working with women who do have over-tight pelvic floors. And each case of pelvic floor dysfunction, pelvic organ prolapse is unique.
Yep.
So there are not two cases that are the exact same, but there are common factors, and that's what we're going to talk to you about today. So one of the first things that we notice that many of these ladies are dealing with is tight hip flexors.
Yep. There's a distinct correlation between the hypertonic or over tight pelvic floor and those hip flexors that are chronically over tight, overworking, trying to do the work of your abs when you'd really like your abs to be doing more of the work. These things often correlate. What's another way they might know?
Another way is urgency. Feeling like all of a sudden when you feel like you need to use the restroom, you have to hurry up and get to the restroom so that you don't have an accident. Another one is pain with sex. That constriction that you're feeling, that tightness is truly contracting and constricting around the vaginal opening. So it can become this reflexive response where when you're trying to be intimate with your partner and something is trying to be inserted, maybe you've had this feeling also with trying to insert a tampon, that the pelvic floor reflexively responses with some women describe it as like a partial contraction or just a tightening up.
Yeah, and it hurts. It's not going to feel good, obviously, and that's no fun. So another thing that can happen if you've got this over-tight pelvic floor is incomplete bladder emptying. And also a very similar situation is a lot of women report they sit down to pee and they stand up and then more dribbles out as they're standing up. They're like, what? Or you might know you have incomplete bladder emptying if you pee and then a few minutes later, like, why do I have to pee again? And you go to pee and there is more pee in there and it comes out. These are all potential signs that you're dealing with this issue.
Yeah. So, a lot of this, the more global things that might be happening in the background is you feel more spun up. You feel more anxious. You feel like all of a sudden you've got more anxiety because you've got this constriction and tightness in your body, specifically in the pelvic floor.
And that can be a bit of a feedback loop because
Yes.
maybe you're a go-getter. You are a high-achieving woman and you're prone to kind of be in that heightened state of alertness and always onness anyway. And that maybe have set you up for some of this over tight situation, and then that makes you feel more spun up. So it can be quite a feedback loop with anxiety and emotion as well.
So if any of that is resonating, if you're thinking, gosh, I think this might be me, we've got 5 holistic tips for you that cost you nothing that you can begin to do today to see if this really makes a difference for you. The first one being something kind of cool that I'll let Christina talk about since she's the singer of the two of us.
This is one of the most little known and little access tips, and it is super duper holistic. It really connects the dots between the diaphragms of the body. We have several layers of tissue that kind of divide our body in this plane. The vocal cords are one of those diaphragms, and the pelvic floor is another. And the diaphragm, the breathing diaphragm, of course, is another. And so if you practice singing or vocalizing in lower tones, you can feel this for yourself. Talk up here, sing like a really high song, and you can feel your pelvic floor kind of like lifting and grabbing. Mm-hmm. If you can find a song that you love to sing, or maybe you're not a singer, but you like to do more of a meditative humming, you can hum or sing in lower tones, and that will actually help to cue subconsciously, which is what we really want, for that pelvic floor to settle and relax and lengthen. and it can be kind of fun in the process. This is not painful. It's not hard to do. If that resonates with you, give it a try. Just sing a high song and sing a low song and feel the difference in that tissue in your pelvic floor. It's a super cool hack for you.
And just to be a little more specific when to do that, my suggestion to, well, our suggestion to a lot of those ladies is do it while you're sitting on the toilet.
Especially
if it's difficult, if you feel that tightness as you're trying to empty your bladder or using
or poop,
emptying your bowels, really try that low humming as you're trying to empty your bowel and bladder, and see if that does make a difference for you.
Is super cool. Another thing that will help to turn down that kind of heightened neural fight or flight activity in your whole body is to get in our back and hip relief position. That link is always available to you in our Instagram bio, back and hip relief button. It is a position you get in that doesn't require any special equipment. 5 to 10 minutes you spend in that position, and you will feel almost like that feeling of you've just had an amazing massage, or for me, craniosacral therapy session. Your whole body just exhale, and it feels so good. And that has a calming, lengthening, relaxing effect on your pelvic floor also.
Yeah, especially if you're one of those ladies that maybe you've been diagnosed with something like overactive bladder syndrome. Some of the ladies that we work with have been told they have that. That is a great position to get into, which was tip number 2. And tip number 3 is, while you're in that position, and we actually teach this in the video that you get when you click on that button for back and hip relief, it is the diaphragmatic breath work. Christina talked in the first tip about the low tone of humming or singing and the diaphragms, and really getting that respiratory diaphragm to move in all 3 planes of motion in that 90-90 position is magic, and getting into that rest and digest state. And that's really important, because this is the state where healing actually takes place. If you are spun up all the time, and we know that stress causes dis-ease in the body, that's also what we're talking about. It's really important that you get in that rest and digest place or state, so that healing has the opportunity to take place in your tissue.
Is so powerful. And if stillness is something that's hard for you, put on a podcast if you must in this position, so you feel like you're doing something, but you're already multitasking, because you're in the position and you're doing your breath work. So you're already multitasking. But if that is hard for you, put on a meditation app, put on some affirmations, put on your favorite podcast or some music. It will be deeply therapeutic on so many levels. And that is an incredibly holistic way to access calming this tissue.
The 4th tip does require a little more effort and money, but it is checking your pubic joint and hips, just roughly seeing if you feel like that is out of alignment. And if it is,
or if you're just uncomfortable checking it yourself or uncertain, outsource this. Go check in with a skilled provider, a chiropractor, a manual physical therapist, and get that checked.
Yeah, because that is incredibly important. And if you come to us, you will learn that is the first step in our program and our methodology, as well as that decompress. So
which
a
includes alignment. And if your bones and your pelvis are not aligned, the muscles and their fibers cannot be aligned either. And that causes them to be like, "Grr!" And that's what we're trying to counteract and help you work away from.
And our 5th tip seems kind of like a nothing burger to a lot of the women that we work with, but it is a big, big deal. And this is hydration. Many women that we've worked with, because they're having urgency and frequency with their bladder habits, they're purposefully not drinking as much water, because they don't.
Just busy.
Yeah.
Count. You will be surprised that you may or probably not drinking enough.
So we recommend just some simple electrolyte drops in your water that you are drinking, so that your body is able to make better use of this. And the reason why this is so important is because dehydration creates a lack of pliability in your tissue. It also creates harder stools. So you're having to press and bear down more, which further perpetuates some of the problems that you're having.
Yep. And it can just sap your energy. You'll be shocked how much more fatigued you can feel if you're dehydrated. all of that does nothing to contribute to that kind of panicked over tight situation that's going on with your pelvic floor. If any of this resonates with you, please try these 5 tips and you will be shocked the difference it can make in your quality of life and the issues that you're battling with pelvic and core function.
Yeah, so just a recap of those 5 holistic health tips. It is low vocalization tones, 90-90, grab that free position,
Back and hip relief. Yep.
breath work, hydration, and getting an adjustment from another practitioner if you're dealing with back and hip tightness and feeling discomfort there.
You got this.